In this video, I'm going to look at this paper by authors from the International Islamic University, Malaysia, and they looked at the different remedies for yaws, which is a bacterial infection, and they looked at ancient Malay medical manuscripts called the Kitab and the different remedies contained in these manuscripts. So yaws is a tropical disease that has persisted in low developed countries, and it is caused by a bacteria known as Treponema pallidum. And it's a part of group of infections that also include endemic syphilis. And poor socioeconomic conditions actually make it spread more because of poor nutritional status and low immunity. So you first see it as lesions on the skin, bone, and cartilage. And without treatment, it can lead to disabilities and deformities because it reaches the bone. And so there's two stages of yaws. The first is known as the mother yaw, which is the primary lesion. As you can see in the photo, just a small lesion. It's not painful, but there can be pus coming out of it. And then secondary manifestations, which can occur months later or even years later, they will be bigger lesions and they will ulcerate and then release a fluid that is very infectious. So in the Malay archipelago, yaws was once prevalent. The Malay people use the term puru to associate these kinds of ulcers that were hard to treat with different kinds of infections caused by the bacteria. This is the bacteria. These are lesions on the bone. As you can see, 2022 is still endemic in Sub-Saharan Africa and Southeast Asia. It's a study by World Health Organization. And this is a dictionary of Malayan medicine that was written by John Gimlet in 1939. And in it, there contains different terms for yaws. In Malay, the term puru, it refers to many different kinds of skin diseases, not just yaws, but also anything that has ulcers or sores. So the author said that they compared the Gimlet's book or list of yaws with other dictionaries, and they found that his dictionary was the most clear because it is a medical dictionary written by a British doctor. So he had worked for a long time in the Malayan Peninsula. So they say that he deeply understood the context and he was very motivated to study Malay medicine. Gimlet had also written other works called Malay Magic and Charms. Here you can see Malay Poisons and Charm Cures, which is also very interesting to scholars today of Malay medicine. So in Gimlet's dictionary, the one you see on the left, there are 19 different terms for yaws. So it's described first, puru dalam tulang, which is the tertiary yaws when the yaws has reached the bone. Ketut puru, puru ibu, the mother yaw, bunga puru, which is flower yaw, flower sore. And the names of the sores, the name of the different kinds of puru is related to what the sore looks like. So like puru bunga, it's bunga means flower, and it is described as like large sores with yellow sticky crusts. Here, puru mata kerbau, the sore that is like the eye of the buffalo, and it's described as very large flat sores. Puru kertas, that is so kertas means paper, and this describes the sores as being very superficial, but also is very difficult to treat, and often children can die from it. Puru tapak anjing means the footprints of a dog, and it's described as sores that are arranged in the form of a dog's footprints. So, kind of like this. Puru parang is a very large rectangular knife, and it refers to a deep ulceration in the foot of especially elderly persons. So in the manuscripts, there are different kinds of remedies. The authors counted a total of 17 medical formulations. So let's look at some of the remedies. The first one, the Axora plant. The instruction says to scrub everything and apply onto the lesion and it will heal. The next remedy is to use the root of the plant on the left, Alucasia, to use the root of the cengkilan, the one in the middle. Take the fruit of the sirih, the one on the right hand side on top, and the flower below, cendana, jangi. Take everything, scrub everything, and apply onto the lesion, and it will heal. The next remedy is to use a handful of fresh ganja leaves, grind it finely, mix with finely pounded rice, apply as a powder for 3 days. Do not take a bath within those 3 days, it will heal. Next remedy is to take the leaves of the rembega and turmeric and pisang kelat. Take the leaves, pound it well, boil with water, add pounded turmeric, tie it well with the daun pisang kelat, the leaves of the banana. When it has boiled, channel the steam from the boiled remedy towards the soles, the ulcers on the soles. So do it 2 or 3 times and God will heal it. The next remedy is to take the leaf of the bintangor paya. It grows in the mangrove. Boil it and let it in the dew. After that, bathe with it. The next remedy is take a ripe black or white kecubung. That's the fruit, I think, of this flower. And then cover it with the meal shell of the coconut. Then steam the medicine on the affected bare feet. The next one, we have this plant, which is called the urang aring. Also, normally it's just seen as a weed. It grows anywhere. It says take the leaves of the reddish shoot or bud, pound it finely, squeeze it, and take its juice. Mix with 3 egg yolks and beat them. Drink it in the morning. It is therapeutic. If God wills it, it will heal. The next one, we have copper sulfate or terusi, turmeric, a tree called the masoya, or in Malay known as mesui, and limau nipis or lime. So these are for yaws, the parang yaws, which are the ones that affect the elderly, and it is very deep. So take copper sulfate, turmeric, mesui, and 15 limes. Grind everything, mix them with the lime juice, apply on the lesion for 3 days. Another remedy uses pepper and an unknown plant. They couldn't find what it was. The method is to take it orally. The next one uses tuberculosis or arsenis acid plant called kemenyan. The flowers you see, belerang bang, arsenic sulfide, cinnabar, mineral, and the coconut shell. Take an equal amount of the tuberculosis, kemenyan, belerang bang, and sedilingam. The tuberculosis with the coconut shell embers, grind them all finely, make it to a powder, and also orally. The authors look for scientific studies to compare how the Malay medical manuscripts use these certain materials in a medicinal way. So the first thing they found that was mentioned was fennel. And they found a study that showed that it has anti-inflammatory and antimicrobial activities. There was a study on rice used in the manuscripts. They are used topically as a powder after bathing or made into a powder or lotion in order to treat the yaws. Sometimes the rice is also taken orally with other ingredients to treat yaws. They found a study on how rice extract can reduce epidermal inflammation and increase the expression levels of anti-inflammatory compounds. Jintan hitam or Nigella sativa in the Malay manuscripts, they were taken orally with other ingredients. The authors found a study of how oral and topical compounds in Nigella can reduce inflammatory cells in the blood. For hand eczema, the use of Nigella and betamethasone shows more improvement. And Nigella ointments improves life quality compared with Eucerin. Manjakani or Quercus infectoria is also mentioned in the manuscripts. The authors found a study of the use of Quercus infectoria topically, which showed antibacterial and antioxidant activities. This is rembega, a Latinian Calotropis gigantea. So in the manuscripts, they use a water boil extraction of rembega to make a remedy, and then it's used by steaming you direct the steam to the source in order to heal it. And there was also a study done on this plant. Gas and water extracts of this plant can show very potent anti-inflammatory activity. There was a study found that when you burn the coconut shell, the smoke actually promotes the healing of burn wounds. So when we think of that remedy that was mentioned in the Malay manuscript about covering, I think it was a plant, you cover it with the shell and then you burn it and direct the steam towards the lesions. Finally, the authors reiterate that while the plants mentioned in the Malay manuscripts have been found scientifically in journals today to exhibit anti-inflammatory and wound healing properties. These complement the treatment for yaws and cannot be said to wholly treat them. And they conclude that the knowledge about Puru treatments in the Malay medical manuscripts are very comprehensive, and there is a very clear description of how to prepare the remedies and how to administer the treatment. And in fact, as some of the plants have been found in scientific journals today to have anti-inflammatory and antibacterial properties, that this could be a cheap form of treatment to curb yaws. So they say that the studies today, it does show that it's significant evidence that they can treat skin lesions well. That's all for this video. Thanks for watching and see you in the next video.